Now, more than 200 people are now thought to have died from Ebola in the outbreak in the Democratic Republic of the Congo. Health authorities battling the disease are facing growing resistance. Arson attacks on isolation centres have forced some sufferers to return to their communities, and many are defying a ban on more than 50 people gathering.
The ban on large gatherings includes church masses, but it hasn't deterred these Catholic worshippers in Bunia. The city is at the heart of the rapidly spreading Ebola outbreak in the Eastern Democratic Republic of the Congo. Some of the faithful say the crisis has driven them to church for comfort, despite the risk.
We know this disease exists, but there are preventative measures Christians must observe. As you see with me, with this face mask, we have wash basins here and there. We must also maintain social distancing. Just because there's a disease doesn't mean we can close the church. That's precisely why we come here, to ask God to help us in all these ways.
Gatherings of this size are complicating the efforts of health authorities to contain the outbreak. Funerals are especially dangerous, as the bodies of people who have died from Ebola are extremely infectious. They're now carried out under Red Cross supervision, with armed police standing guard. And 2 of the 3 Ebola treatment centres in the region have been burned down by residents.
It's up to us to sit down with everyone, to explain the situation and collectively decide how we can best respond to this outbreak. We ourselves have just had an empty tent burned down 2 days ago, so we know how crucial community engagement is.
The World Health Organization says the outbreak now poses a very high risk for Congo, up from the previous high, though the chances of the disease spreading globally remain low.
DW's Wendy Bashi is DW's bureau chief in Kinshasa, the capital of the Democratic Republic of the Congo, and she told me what action the city is taking.
In Kinshasa, we doesn't have any case for the moment, so we remain very cautious, and we still respect the preventive measure. And this is how we are dealing for the moment, since they have announced this new Ebola outbreak here in DRC.
What are these preventive measures? What are you following?
We are following the preventive measure, like to wash our hands most of the time that we greet people. We need the sanitizer. We also limit, in French we say geste barrière, so we have a limitation of hugging people, giving the hands, and we have some distances like we had during the COVID time. We still have the same measure here in Kinshasa.
Right, that sounds very familiar. Now, unfortunately, there have been reports about arson attacks on Ebola treatment centres. Now, that's not helpful when you try to help people. What triggers those attacks?
So, if I can say, since Thursday, we had actually 3 attacks. One was in Rwampara, the other one was in Mungwalu, actually in the Ituri, where the Ebola started. And the other one, the recent one, was in Butembo, in North Kivu. When you discuss with the healthcare worker, they will tell you that there is a lack of communication between them and the people that have difficulties to accept that the member of the family, the beloved one, died with Ebola. Some of the people say that Ebola doesn't exist. They don't believe in Ebola, and so they don't understand why the healthcare people want to make the safe burial. So when we discuss with the people, with the communities, and even with the civil societies, this is what they are telling us. Some of them, they don't trust in the existence of the virus. And on the other end, the people who work in the healthcare station or center, they're still asking us, especially the media and the radio, to tell the people and to make shows to show the people that Ebola exists and Ebola does kill people, and they need to respect this measure of prevention and also to respect the safe burial. This is really important to stop the spread of the virus, actually.
And does the government support the healthcare workers or you when it comes to informing people, raising awareness? I mean, what kind of measures are in place in order to stop that virus from spreading?
To stop the virus spreading, I think the most recent action that the government has taken is the fact that all the flights coming from Bunia or going to Bunia are now suspended. This is a measure that was made public yesterday during the night. And also for the people who are living in the areas under the M23 control, they have stopped all the travels from Goma to Butembo. They have asked people to stay in the same place. This is what I can say from the traveling of the people within the DRC, from the place where there is Ebola and to the place where there is no Ebola for the moment. For us as journalists, they are providing information. We have like a bulletin, we call it in French here in a bulletin that give us all the day the situation, the epidemic situation, and how many people are affected. So we have all the official information, all the official numbers, and this is how they are trying to make a very big plan of riposte regarding this spreading of Ebola.
Right. Wendy Bashi there, Kinshasa Bureau Chief. Wendy, thank you so much for your time and stay safe.
Thank you.